New stakeholders in the fight against gender-based violence now say lack of adequate data on issues such as FGM, that is female genital mutilation, has made the war against FGM weak. The stakeholders who met in Isiolo say several counties have lagged behind in making strides towards eradicating the harmful practice owing to insufficient civil engagements to rally communities to abandon the practice.
Amid heightened efforts to eradicate female genital mutilation practices in the country, stakeholders met in Isiolo town to sensitize people on FGM and devise ways to eradicate the practice. Anti-FGM activists noting that a lot of civic engagements needs to be conducted to enlighten mothers on the effects of FGM.
Though kuna suna nyingi ambayo hatuzitili mkazo, lakini hii tumeitumia sana, ambayo unapata kwamba yule anakeketa anageuka haki ya yule mtoto. Na tukiangalia chapter 4 ya Bill of Rights katika katiba, mtoto ana haki.
Meanwhile, civil society groups in Nairobi have condemned increase in cases of gender-based violence and defilement cases against girls and women in the country. The groups are demanding for the formation of a special committee to investigate these cases and give recommendations on the best way forward in dealing with the matter.
The pain and trauma that we have seen unleashed on our children in this country has gone to a higher level that is unprecedented in our nation.
In the same breath, the Forum for African Women Educationists say kangaroo courts, poverty and lack of parental supervision are to blame for the soaring number of teenage pregnancies in the country. The forum leadership says settling of gender-based cases out of court has been an injustice to those affected.
We'll also be doing sensitization of law enforcement, as they are the people where cases of defilement get reported, so that they're able to address this better and refer it through the proper channels. And we are hoping that when we apply a combination of these interventions, we will be able to see a significant reduction in the cases of teenage pregnancy in the period of 2 years. And we have started with a baseline survey, the entry point, and we will be tracking against this to see what the impact will be in the next couple of years.
There's always some stigma that follows these girls in schools because they are always aware that they are mothers, and therefore the issue of prevention is very important. Wakati ule ambao utanyamaza, uwafiche, usiwaambie anything, you must sit at the table na wote na kuwaongelesha ukweli.
The forum, which sensitizes communities on ways to report such matters, wants priority accorded to the youth, parents and community leaders. For Lunchtime News, I'm Gladys Mungai.